Hello to everyone. This is Mirina Uchaska. I'm the director and the founder of 70 Flowers Echo Autism. And it is my pleasure to have two wonderful colleagues from joining us from Thessaloniki, Greece. They're a speech and language pathologist and an occupational therapist, and they specialize in feeding disorders. This is a natural progression of our last series from our past month's meeting where we were discussing feeding disorders. But what we decided to do is actually gather our parents and our patients, actually questions from our parents about their children's feeding, and do a compilation for you where we will read the questions that we have gathered previously so we can get expert advice from our guests today. So I would like to introduce my wonderful colleagues from the clinic NOIMA based in Thessaloniki, Greece. First, I would like to invite Mrs. Irene Zdoku to introduce herself.
Hello, I would like to thank you one more time, Mary, for the invitation. My name is Irene Zdoku. I am speech therapist, and I have done a lot of seminars, and I am specialized in feeding and eating disorders. I work with Anastasia together, and we have a very good cooperation in these disorders, and we have very good results in children. It's great honor for us to be here today. I love so much to discuss and exchange opinions and knowledge about such an important topic as feeding.
Exactly.
Feeding is a function with vital importance, and the most people feed without thinking about it and enjoy the process of feeding the meal. Because feeding is a sensory process, and its role is multidimensional. But everything is not go so good for everyone. There are a lot of children with neurological issues or not who don't enjoy the meal, who are not able to complete the meal by themselves, appear aversion to the meal, to certain foods or taste or textures. The last years, children who appear eating disorders and selectivity are more and more, and parents feel so disappointed and many times confused because they don't know which is the correct the solution, which is the correct strategy, and which is their role. So I believe that it's our responsibility as a therapist to help them to find the way they have to react in order, first of all, to help the children immediately and properly, and second, to prevent the difficulties to become problems. Thank you again, Mary, for the invitation.
Thank you for this very detailed introduction to feeding disorders, because Irene, as you said, this happens, and a lot of times feeding is a process that is looked at with so much joy, and also a very important social interaction piece, even in adults. But we also know from experience that feeding can be the most stressful event in the parents' lives, especially when their babies or children are not thriving. And now I would like to invite your colleague, Miss Anastasia Lazaridou, to introduce herself briefly, and then I will be ready to read our first question from our audience.
Hello, I'm Anastasia. I'm an occupational therapist for 10 years now. I worked with Irene many years, and I think she said everything around food, the needs, priorities, the things we have to do to help the families work it out. I have nothing else to.
Thank you. Yes, yes. So then I will proceed and I will read the first question from our patients. Of course, it's a general one. We cannot be very specific, but of course, it's when do I have to be worried about my child's feeding and what can I do? What are the signs that something may be wrong with my child's feeding process?
Okay. Um, as we have already said, feeding has a multidimensional role. Actually, only the first months of life, the role of feeding is only related to hydration and calories. As the baby grows up, feeding has more roles, sociability and independence. The way in which the child's function of feeding will develop is directly related to the habits of family. However, there are some standard characteristics. The child should enjoy and involve the process of feeding. The child should follow the changes of the way that it has to be fed only exclusive with milk, then with blended or baby-led weaning process, then with solid food, then the child tries to eat by itself, and at the age of 2 years old, the child completes the way that he eats, and the child is independent child.
I see. I see.
So the child use the utensil like spoon, cup, and try to be independent child. After 2 years old, the child should be complete the meal in 20 minutes without need without the need of other things like tablet, like toys. Child should be complete the meal without break and with the whole family. It's
see.
very important to eat all the family together because of the roles of food.
I agree because as they
Child
develop,
should, yes,
they actually are developing and they're starting to eat the common food that is consumed by the entire family, so they can be involved in the whole process.
yes, because child should be able to eat a lot of food from different nutritional groups and in different textures.
Okay.
When we don't have all these beautiful things, for example, a child doesn't enjoy its meal, or the meal time is not a pleasure for it and its parents, or if the child appears aversion for the process of feeding. When both of them, child and parents, are anxious about the process, it's very good idea the parents visit a specialist therapist, OT or SLT, to help them.
I see. Yes. And especially within our profession, we have specialists who specialize in feeding disorder. And this is the reason why we have the honor to have both of you here, because in your clinic, you work with children, not only with special populations who have feeding disorders, but also with normally developing children with feeding disorders, children on the autism spectrum. So this expertise is actually very important and crucial to the child's development. This leads us to question number two, which actually is posed by a mother. She says, my child is 2 years old and is still fed with blended food. Um, how does this prevent acquisition of language, and is this a problem that my 2-year-old child is still eating blended foods?
Mhm. It is a very common question. Many parents has this question. Actually, the control center of swallowing mechanism is in a different area than the speech center. This means that a child who eats blended food can talk. The child is able to speak. On the other hand, such as we use the same structures, tongue, jaw, lips, cheeks, for these two functions, maybe the child who doesn't have adequate mobility, adequate strength
Strength.
in these structures, maybe has articulation problems.
Yes, I see. So more, basically also difficulties with the oral motor mechanism as well. Um,
Furthermore, the recent studies have shown that children who don't develop function of feeding typical until 3 years old, and what we mean typical, to change the way of feeding, not eat with not be fed with blended food until 2 years old. It's not so typical. This have uh, one more thing is that they cannot handle solid food. One thing that's not typical means that they cannot complete by themselves the food. Someone else is fed them. Not typical means that is not able to sit in a chair and finish the meal, but they have the need from other stimulation of the environment, like tablet, like toys, like music, or they want to stand up all the time. All this is not in typical development of feeding process. Studies have showed that children who have this clinical image maybe have a delay in acquisition of languages. So they are connected.
exactly.
And the reason that they are connected is because one of the role of feeding is the sociability, socialization.
Exactly. Yes. Um, we also work with children on the autism spectrum, and this leads us to the third question, which actually also points to that very often children with autism, autistic children, or children on the autism spectrum will have feeding disorders and sensory disorders. So the next question that is asked by this parent is the following. It says, my child has autism, uh, high functioning autism, and but he doesn't eat many foods. He's very picky. He prefers just to eat a certain color of a food or a certain question. for a certain, texture, is that a problem? The mother is asking.
Many children with autism have eating disorders because they have a sensory background or a behavioral background, or because they made some connection with a very strange way, I can say, maybe. Patterns.
Patterns.
Yes. If it's problem, the selectivity of child with autism depends on the expectation of the family, whether this situation affects more their sociability, whether this condition affects its health. Autism is a pervasive disorder that affects different domains and consequently the functionality of the individual. Children with autism must fight with many things. After a detailed assessment, therapists, in cooperation with parents, prioritize the child's needs. If sociability is one of the goals, sometimes, and this child has also eating disorders, sometimes if I work on sensory disorders and eating disorders, maybe can improve child sociability because of the role of feeding.
Exactly. Yes. Yes.
So if the parents feel that this is problem, the therapist must listen to them and help them in this attitude, in this topic too.
Yes. And we can also stress for the parents with newly diagnosed children with autism spectrum disorder that they should be on the lookout. They should watch for different patterns, whether they're sensory or feeding issues, and they need to seek help as soon as possible because the sooner the intervention starts, especially with the feeding, the better it is, even though this is also a long process. It could be a longer process. We may stress that. Okay, so the next questions leads us into the following discussion around tablets or watching TV or cartoons during feeding times.
Yes.
It says the following: when I feed my child with tablet or TV, and I must say I'm guilty of this. I have done this in the past because, yeah, sometimes, not always, but I have done it. I am able to feed it many good textures and an adequate quantity with regards to the age. Can I continue? Is it advisable to continue to feed my child in this way? Because this is the most effective and the fastest way for me to feed him.
Okay, I think that many parents have done this, to use a tablet or a TV in order to feed their child. And I have to think why, in order to understand if I have to use it or if I have to stop it. Every time we have to have a very clear goal. If my goal is to feed all the quantity of the food to my child because I have the doctor to say that your child must increase the weight.
Yes.
Okay, maybe I will try many ways. If I think that my child doesn't have any problem with its development, about weight, about everything else, but I understand that my child has eating disorders. My child has selectivity regarding food, and I use the tablet in order to feed quickly him. Okay, I understand that I have to stop it because I cannot, with this way, I cannot help my child to develop the process of feeding in a typical path.
I see.
When I use TV or a toys or a tablet during the meal, my child's attention is not to the meal. The process of smell, the process of taste, the texture of food, my child doesn't understand all of this. Child doesn't involve with feeding. So I all the time the parents must think, and I really use the word must think, why they use it. If they have a very a more worst problem, medical issues, okay.
Yes. Yes.
But if this is because their child is selective or it's picky eater or have something else about its attention about food, they must stop it.
I see. I see. Thank you. Thank you very much. That was a very detailed answer, Irene. So as we are actually progressing, we started with the question, what should we worry about, right? And then we covered a certain age group, then autism spectrum disorders. But now this is a very interesting question where a mother of a 4-year-old child asks, she actually, I think it's more of a maybe behavioral issue, but you as experts will answer this. It says, my 4-year-old child eats everything if I feed her. Otherwise, she refuses to eat and she refuses to use any utensils. What should I do?
Okay. At the beginning, we should talk about the development of self-feeding as we grow up, which is a very important daily life skill. At the very beginning of the baby's growing up, at around 4 to 6 months, the parents, the caregiver, introduce the spoon. So it experiences, it looks the spoon, it starts to gradually understand that the food comes from the table to the mouth. Gradually, as it gets older, around 1 year old, it starts picking small pieces of food and bring it to mouth, etc., etc. So by the age of 3, the child uses utensils to feed itself. To feed itself, to feed the mother, to feed other siblings. So it's a very important daily life skill for socialization too, and communication. As Greek, we know about this, food and talk. And
yes, yes, yes.
We must first make sure that there is no other difficulty. If we notice that the child has some difficulty in some fine motor or perceptual difficulties, then we should address to our pediatrician, and from there to an occupational therapy evaluation. If we know for sure that is more like a habit that is grown through the years, then we must try to change. There are many strategies that we could try. For sure, we must make sure that we offer utensils to our child to use it, to make a mess, to experience the process. Okay, it helps. It helps to eat together, family meals. At the beginning, we might want to try to have finger food to make sure that the child feeds itself with fingers. Okay, I think it's a good start. And from there, we can try games, activities outside of mealtime. Play, symbolic playing, pretending to cook with utensils, pretending to feed a baby doll, pretending to feed our siblings, and etc., etc. So the child starts to make a picture of how it is to use and to use more functional the spoon, the fork. At last, it could be that the child gets frustrated because it tries to feed itself and it cannot do it the way mother does it.
Yes.
And it gets frustrated and it gives up. And we can try to follow the steps of the child to help him as much as it needs, not all the way. We might need to scoop the food for it and hand it over, or we can with a fork to cut the food so we can offer it already there. That's some strategy we can try with the child so it starts to experience more functional and more to participate more to the daily life activity as feeding, eating.
Thank you, Anastasia.
I think that one very important and magic word that they can have in their mind, the parents, is facilitation. Parents should help, should facilitate their child to feed by himself, not feed it.
Yes.
Exactly.
Accommodations. Yes.
Yes.
Right. And I think this, we all have the habit, especially nowadays, as we all live very busy and fast lives. It's, I think, most important that I want to give my child as much as I can in the fastest period of time, the nutrition and everything. And then oftentimes we overlook these very important steps where the child actually needs to be able to feed herself, to be able to use the utensils. And also, there is a question by another mother from about a 3-year-old child who is still having a difficult time sitting at the table. So the parents are seated at the table, but the child just stands by the table and would not sit in any way. The child used to sit in the sitting chair, in the baby chair when it was little, but now that the child is older, it just does not like to be while is seated.
Okay. There could be many factors that this would happen. It could be sensitivity to some food. Maybe they forced fed him something, and this brings him her this response, not want to sit to the table. It could be postural issue. If the child cannot sit well, doesn't feel safe at the chair, it could be hard for it to maintain the position.
Or to maintain, they are not able to maintain this position for a long time.
Yes, of course. So it's important to, as I said before, Irene, facilitate to make accommodations, use a chair that's suitable for the child, use some cushions to give postural control. Another thing that you mentioned before is distraction. The child might get really distracted from the environment. If there is a TV on, a radio, toys around the house, it could be very distractive for it to manage to handle the mealtime. It could be a combination of all of this, of course. In general, the mealtime should be very structured. It should be a routine about time, the place, the rules around the food time, the meal time, and try to keep up with it. And of course, always make sure that the child does not feel obligated to eat something if doesn't want to eat, and not last very long meal time, around 20, 30 minutes. No more than that. No more. And if you want to try, and the child is has the cognitive skill to come to an agreement with you, you should try to play a game. 4 bites, you can go around the table, come back. 4 bites, it's a start to begin when you want and need to make him, her last longer on the chairs. It's a process.
Right, exactly. Thank you very much for these detailed answers to these questions. And, I'm grateful to our audience for listening to us and also for asking us these questions. I have one last question. I hope I won't take too much of your busy time. And that is, what should be the role of the parent that is under a lot of stress for a child, or for, let's say, a baby, maybe a 1 or a 1.5-year-old that is not feeding and that has failure to thrive. And don't worry about, yeah, a lot of things happen during always my clinic.
Sorry.
Noises and things, we're in normal environments, right? I don't think the listeners, the audience would mind, but yes, what we overlook a lot of the times that what is the role of the parent and the support that the parent can actually offer, and that the parent needs as a parent to be a good example for the child. Because a lot of the time I have seen, I'm not a feeding expert per se, I am more in the other realm of working with autism, right? But I see parents who are under a lot of stress. And when you bring so much stress with you and you try to feed your baby or your child, that just makes things more complicated. So what would be your advice for the parents this time?
Okay. It's very difficult to work on feeding or eating disorders, actually, because your goal is to change the way the child is fed or the child eats. But all of this, you have to communicate and ask the help from other people, parents, grandmother, grandfather, and many other persons maybe are involved in all this situation. The other difficult thing is that feeding is a process that becomes 4 or 5 times per day. So all the intervention becomes at home, not at the clinic.
Yes, yes,
So our role is to help the parents to understand how important is the child feed with a typical way by himself, and to eat a lot of foods. This is the difficulty,
yes,
because our most protasives suggestions, the most suggestions is too simple, and many times the symbol is difficult to understand,
yes,
because you did this, you do this many times, and you cannot understand that you have to change a little. My suggestions to the parents is I want they don't feel guilty. It's not their
Yes.
fault.
yes,
For different reasons, the child follow the path, and not path not typical. And the most times the parents, because they love their child, follow this path because they feel that in this path the child is happy. Please don't. Our role as parents is not to put the food in a child's mouth. My role as parent is to offer different foods, different textures. I offer foods my child loves. I offer him some food doesn't like, because during the experience I know that I can change the way it thinks about feeding.
great.
So facilitation is one thing, and the other is that the parents have to offer opportunities about different textures, different vision of, to see the food, not only to eat, to see, to smell, to touch. Yes,
Yes, yes,
this is my suggestion.
yes. Excellent. Thank you so much for your precious time. We know that you've had a long day ahead of you, and still, yes, to see and help other patients and parents. I think that this session is very important because it will offer our parents with valuable insight about some of the issues that they could watch for. And if we start to talk about specific topic, we could probably talk for hours just on,
Yes.
right? Is it infants, toddlers, different textures, different approaches? But we hope that with these questions and your answers, we scratched the surface, and that this is, I know this will be very helpful to our audience, wherever they are listening to us from. This session will also be recorded and put on our YouTube website, so it will be available to viewers anywhere. So I'm very grateful to both of you that you were with us today, and I hope to see you again. And I hope as the needs of the parents and the interests are actually, this is an issue that is so overlooked because it's always about communication so much. My child is not talking, and this is always the very big concern. Even when they go to the doctor's office, the doctors always check. Yes, obviously, if the baby is not thriving, they can see, oh, the baby is not gaining weight. But if the baby is gaining weight, but if it's, let's say, restricted to just one type of food, they don't view that as an issue. And the parents themselves don't look at it as an issue until the child becomes older, and until that actually becomes a problem that is as big of a problem as not being able to communicate appropriately. So,
Exactly.
yes, again, thank you very much. And
Thank you.
I hope to see you soon again. Thank
Thank
you.
you.
Thank you.
Bye.
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 Bye. Bye.